In this video, we will be reviewing cerebral vascular accident, more commonly known as stroke, by critically thinking through 5 questions. I will read the question for those listening to the video, then pause to give you a second to think of your own answer. Then I will read the options and we will discuss. This is just a surface review. If you need more information on stroke, refer to your nursing resources under neurological and/or the vascular chapters. Let's get started. Number 1. The nurse is caring for a patient recovering from ischemic stroke. Which of the following statements made by the nurse are correct? Select all that apply. You should be thinking about everything you remember about an ischemic stroke. Answer choices. Is it number 1? Ischemic stroke results from narrowing emboli or thrombus. Remember, emboli and thrombus are blood clots. Number 2. Some etiologies of ischemic stroke are hypertension, diabetes, and smoking. Number 3. Ischemic stroke can be caused by over-therapeutic anticoagulation therapy. Number 4. Ischemic strokes can present with a headache, so be sure to call your doctor if you experience one. Since this is a select all that apply question, the best technique is to use the true-false method. Number 1 is true. Ischemic strokes are the result of narrowing emboli or thrombus, which obstructs blood flow to the brain. Number 2 is true. Some of the causes of blockage are narrowing from hypertension, thickening of blood, which obstructs in diabetes, and then smoking, which promotes vasoconstriction. Number 3 is false. Ischemic stroke is not caused by too much blood thinning medication. That would be the hemorrhagic stroke, because hemorrhagic strokes are bleeds in the brain. And number 4 is false. Ischemic strokes do not present with a headache. The hemorrhagic stroke is the one that presents with a headache because blood fills the skull and causes a lot of pressure in the brain. Therefore, the answers are 1 and 2. And your thoughts should have been about the origins of an ischemic stroke, which are all from the narrowing and obstruction, preventing blood and oxygen from getting to the brain. If you had a hard time with this question, make sure you know the different types of stroke, ischemic and hemorrhagic. Question number 2. A patient is diagnosed with frequent episodes of transient ischemic attacks, or TIAs. Which statement from the patient would require further intervention by the nurse in response to stroke prevention? So think about what you remember about stroke prevention. Is it number 1, I will consider a smoking cessation program? Number 2, I will check my blood pressure every time I go shopping where they have blood pressure machines and make a note of it in my journal. Number 3, I will make sure I check my blood sugar before every meal. Or number 4, I will continue to eat lean proteins. In this question, we want to make sure that we're picking what needs further intervention. So which statement is wrong? On first look, it doesn't appear that any of them are wrong, but the one that is possibly questionable is number 1. The client should already be on a smoking cessation program when they leave the hospital and not just be considering a program. Therefore, number 1 is the answer. In your thoughts, you should have been thinking about things that are preventive so that it would have been easier to spot the one that is wrong. If you had a hard time with this question, make sure to review prevention for ischemic strokes. And that is smoking cessation, healthy diet, exercise, controlling hypertension, high cholesterol or diabetes, and then making sure to stay on blood thinning medications if ordered. Because the TIA is the number 1 warning sign of an impeding stroke, and intervention is necessary if a client is having a lot of TIAs. Question number 3. A client is admitted with signs of a CVA or stroke. The patient is complaining of a headache, blurred vision, projectile vomiting, right-sided weakness, and facial drooping. The patient is ordered for a lumbar puncture. The nurse is concerned with which of the following symptoms that are contraindicated for lumbar puncture and informs the physician. Select all that apply. Is it number 1, projectile vomiting, number 2, facial drooping, Number 3, blurred vision. Number 4, headache. Or number 5, right-sided weakness. Because this is a select all that apply question, we're going to use the true-false method. Number 1 is true. Number 2 is false. Number 3 is true. Number 4 is true. And number 5 is false. The thought here is that this client is presenting with a hemorrhagic stroke. And the way we know that is because the presentation is including the signs of ICP. And it's those signs of ICP that are dangerous and contraindicated in somebody that is going to get a lumbar puncture. Because a lumbar puncture can actually increase ICP all on its own. And so a lumbar puncture should not be performed when there are signs of increased intracranial pressure. And that is numbers 1, 3, and 4. If you had a hard time with this question, make sure to review ICP signs and symptoms and know those symptoms so that you can inform the doctor if somebody's ordered for lumbar puncture. Question number 4. A client is admitted for stroke. The nurse is monitoring the patient's level of consciousness using the Glascow Coma Scale. Previously, the patient was a level 10. What is the patient's score based on these findings? The patient's eyes open when spoken to, speaks in words that do not make sense, and obeys motor commands. And what should the nurse do based on the number? Think about what their Glascow Coma Scale is and how you should intervene. Should you, number 1, notify the doctor because the Glascow Coma Scale is a 12. Eyes are 3, verbal is 4, motor is 5. Or is the Glascow Coma Scale an 8, eyes are 2, verbal is 4, motor is 2, and you should intubate the client. Number 3, is the Glascow Coma Scale a 12, eyes are 3, verbal is 3, motor is 6, and the nurse should just continue to monitor the client. Or number 4, is the Glascow Coma Scale a 10, eyes are 3, verbal is 3, motor is 4, and the nurse should also continue to monitor. The thought here is really to remember how to do the Glascow Coma Scale. If you had a hard time with that, stay till the end of the video, and there's a quick slide on trying to make that a little easier for you. In this case, the eye opening, it happens when they're spoken to. So that would be a 3. Verbal is, there is a response, but the words aren't making sense. So the verbal is also a 3. The motor commands happen normally, and so that is a 6. Therefore, the answer is number 3. The Glascow Coma Scale is a 12, and since this is an improvement, and 12 is also not a concern, the nurse should just continue to monitor. Make sure to review the Glascow Coma Scale and know when to intervene. And remember, not everything you get on the test is a problem. In this case, the patient is improving, so we can just continue to monitor. Question number 5. A client with residual symptoms post a right hemisphere stroke is being cared for by the nurse. What are appropriate interventions if the patient has expressive aphasia, hemiplegia, left side neglect, and postural hypotension? Select all that apply. Think about the different interventions for the patient's presentation. Would you, number 1, speak slowly to the client so the client understands? Number 2, hydrate the patient to treat postural hypotension. Number 3, allow for the client to answer questions before moving on to the next one. And or number 4, approach the client from the right side so the client can see the nurse. Since this is a select all that apply, we're going to use the true-false method. Number 1 is false. We're not going to speak slowly to the client because they don't have receptive aphasia. They have expressive aphasia. Number 2 is false. We don't hydrate the patient for postural hypotension. That is for orthostatic hypotension. Postural hypotension involves a slowed vascular response to getting up. So the best answer for postural hypotension is to just give them time and let them get up slowly. Dangle at the side of the bed before you sit them up. Number 3 is true. Because this client has expressive aphasia, we should allow them a little bit more time to answer questions and slow down before moving on to the next one. And number 4 is also true. When a client has left side neglect, you want to make sure that you approach them from the right side, that you put things on the right side of their tray so that they can see them. It doesn't mean that you don't do anything to the left side. Of course, you're going to do range of motion and encourage them to use that left side. But as far as intervening, we definitely want to make sure we're approaching them on the right side so that they can see us. Make sure to review your interventions for the different types of residual associated with a stroke. There is a lot of different issues that can happen post-stroke. There's verbal problems, there's motor problems, there's cognitive problems, there's memory problems. It's a good idea to learn these and to know what to do about them. This slide is to help you all remember the Glascow Coma Scale a little easier. At least I hope this makes it easier. In the Glascow Coma Scale, you can remember that there's 3 sections that get scored: eye, mouth, motor, and conveniently that goes 4, 5, 6 for the number of choices. In each section, you can remember that the choices are from normal to none. Normal being your highest number, none being 1. No score is ever a 0, which means nobody can score a 0, 1, or a 2. The lowest score for a Glascow Coma Scale is a 3. So in each section, once you have your normal and none, then you have to fill in the middle parts. So for eye opening, we only have 2 choices in the middle. If somebody is opening up their eyes to your command, that's a 3. And if somebody is only opening up their eyes when you give them a little pressure point stimulus, like the sternal rub or the trapezius squeeze, or you can even push on their mandibular pressure point, that would be a 2. In the verbal response, between the normal and none, we have 3 to fill in. So a number 4 is if they respond to you, but you have commanded them to kind of talk to you, and they're responding correctly. A 3 is that they're responding, but their words really don't make sense. You can understand what they're saying, but they don't make sense and they're kind of incorrect. Or a 2 is that you just kind of hear some muttering, so it's incomprehensible and you really can't understand what they're saying. In the motor response, between the normal, which is a 6, and the none, which is a 1, we have 2 options that deal with pain and then 2 options that deal with posture. So a 5 is when you put a pressure point on them and they push you away. That is more responsive than somebody who just withdraws when you try to sternal rub them or something. And then in posture, we have 2 choices. We have decorticate posture, which is better than decerebrate. A decorticate posture is when you look at them, they're kind of pulled into the core. Their hands are folded in. And this is a better posturing than decerebrate. The decerebrate posture, if you can find that B, to remind you, this is when the injury has extended to the brain stem, which is not good. And that makes the patient more straight, like a stem, and with their hands are turned out a bit. So that gives you your other numbers. Normal 6, pushes away from pain is a 5, withdraws from pain is a 4, decorticate posture is a 3, decerebrate is a 2, and then kind of a flaccid posturing in the bed is a 1. And just something quick that I learned in nursing school, maybe this will help you too, to know at what point the score is bad. I was taught that 9 is fine, 8 intubate. So hopefully that helps you a little bit more in Glascow Coma Scale. Thank you for joining us in this quick review of stroke. If you'd like to see more content like this, like our channel and find us at sciencestrategies.com.